My name is Emily Dwosh, and I'm a genetic counselor, and I work at the UBC Clinic for Alzheimer's disease and related disorders at UBC Hospital in Vancouver. Essentially, our role is to help individuals and families adjust to a new diagnosis of any condition, and then more specifically to provide information about the role of genetics in that condition and what the diagnosis might mean for other family members, and to make sure that patients and families are aware of relevant genetic testing options and to support them in decision-making around genetic testing in a non-directive. And in addition, we also make sure that we connect families with resources that might support them down the road. I think what makes the genetic counseling role in the Alzheimer's clinic a little bit unique from other genetic counseling roles is that our patient population, because of their cognitive concerns, the counseling may not be specifically with the patient, but with their support network. So it immediately becomes like a family affair. And also too, I think in the counseling process, a lot of what we do as genetic counselors is a focus on effective communication, and a unique aspect of genetic counseling in a memory disorders clinic would be adjusting that communication to suit the needs of not just the family member, but also the patient themselves. And so it's a matter of, in a quick way at the outset of every session, establishing what level the information would be adjusted for, and always being mindful of checking in maybe more frequently than we would do in other genetic counseling settings. So yeah, the nuances of the communication piece I think are a little bit unique, dealing with cognitive concerns. So there are some neurodegenerative diseases, for example, like Huntington's disease, which is always a purely genetic condition caused by a single gene mutation. But there are many other neurodegenerative diseases that are rarely purely genetic. For example, Alzheimer's disease is usually not a purely genetic condition. It can be purely genetic, but those would be rare cases of Alzheimer's. The majority of Alzheimer's disease is what we call multifactorial in its cause. It's the reason for the onset in most people is due to a complex combination of many factors, including the aging process, lifestyle and environmental factors. And there is a role for genetics in those common cases of Alzheimer's, but not in a causative way. It's in a susceptibility way, where there's genes that increase or decrease a person's predisposition to getting Alzheimer's. Right now, if we're speaking about Alzheimer's disease and other forms of dementia, like Lewy body disease, frontotemporal dementia, the contribution of specific genetic factors or the identification of a specific gene mutation in any of these conditions currently doesn't alter patient management. Right now, there are no specific medications or therapies that are unique to the genetic forms of these diseases. The identification of specific genetic factors in these families, while it won't change their management, it could allow for their children, for example, to know their own likelihood of developing Alzheimer's and have options for what we call predictive genetic testing. And this option of genetic testing is presented with that mindfulness to this aspect of choice and individual freedom of choice. And so our role as genetic counselors is to present the options of testing and review the implications of the testing and what would the possible outcomes be of that testing, and then to help families make decisions. So we do see Alzheimer's patients, but we see many other cognitive disorders such as Lewy body disease, frontotemporal dementia, vascular or stroke-related dementia. We also see a lot of individuals who do not meet criteria for a diagnosis of any of those conditions. They may have come for an assessment because they've got some cognitive concerns, but they're mild. So there's actually a clinical diagnosis of mild cognitive impairment that could be made, and we see lots of patients in that category, and they're monitored longitudinally. I might see, young people in their 20s and their 30s who are just seeking out information about the role of genetics in memory disorders, all the way up to, people in their 80s and 90s. I would say the average age of the people that I see in terms of patients with cognitive concerns of their own, nowadays, I would say 50s and 60s is probably the most common age of the patient group that I see. Which is a bit younger than when I first started working in the clinic 20 years ago. I think it is still a common misperception that it's genetic, purely genetic, more often than it truly is. This understanding of Alzheimer's being most often not purely genetic and multifactorial, it still surprises a lot of people. Another very common misperception in the Alzheimer's world is that if a person has Alzheimer's at a younger age, for example, onsetting in their 50s, early 60s, that early age of onset equates that diagnosis with familial or genetic forms of Alzheimer's disease. Even young onset Alzheimer's patients have a multifactorial etiology to their condition. Just because you're younger when you have that diagnosis doesn't mean it's the rare genetic form. We need to look at that diagnosis in the context of a family history. We're very fortunate in our clinic that we have a social worker who's part of our multidisciplinary team. So she's a wonderful resource for our patients and their family members. We also work closely with the Alzheimer's Society of BC, and we refer our patients over to their First Link program, support groups or activities in the patient's community, just being a listening ear. I also connect families with online websites, resources for the particular, more unusual conditions that we see. I think the Alzheimer's Society of Canada's website is a very, very good place to start for anyone who just wants general information. Yeah, if people are interested in becoming involved, I know that there's always volunteer opportunities through the Alzheimer's Society of BC. Either to work on their helplines or help with fundraising. There is a program now that's run out of the Centre for Brain Health on UBC campus, which is called the BC Wellness Program. Free classes for patients with neurodegenerative disease and their family members, their support teams, the general public. I think given COVID, one thing that I would comment on that I've noticed over the last 8 months or so since all this has happened is that the experience of COVID has been, I think, particularly challenging for patients and families who have Alzheimer's or any of the other memory disorders that I see at our clinic. The person-to-person support of friends and family coming by, spending time, providing a bit of respite, providing an activity, and that's not able to happen with COVID restrictions. My encouragement would be if you know of someone who's dealing with any of these conditions, to make an effort to reach out and touch base, because people are really, I think they're struggling, and even just to have someone call and check in and ask how you're doing can make a difference. I think another aspect, especially of neurodegenerative conditions, which by definition are progressing over time, is that a lot of families that I've been speaking with over the last few months have alluded to sort of this lost year, that plans to travel, plans to spend time with loved ones before the condition progresses. everything has had to be put on pause. But if someone has a degenerative condition, they've lost that valuable time. Yeah, and there's no real recourse. It's just, I think, if you know someone who's dealing with that diagnosis, to be mindful of that experience that they're having, and it does give their COVID experience a bit of a different twist than for the rest of us. I think there's a lot of really incredible research happening right now, both on the diagnostic side and the treatment side, and as well the genetic side. I think our approach to neurodegenerative diseases, I think, is going to change quite a bit in the next 5-10 years. If there are students with bright minds who are wanting to take on these challenges, now's a great time to get into the field.